My friends, this is Dr. B, the best doctor in medicine and the most caring doctor in medicine. Today, Dr. B wants to remind you to never forget that after more than 30 years in medicine, Dr. B genuinely loves you and Dr. B genuinely cares about you. And I say this from the bottom of my heart. Today, Dr. B wants to tell you about the superiority of bariatric surgery over the medications called the GLP1 receptor agonists. There are two major ones, semaglutide and tirzepatide. Do you see it? Mounjaro, OZEMPIC, Wegovy. I mean, these medications called GLP1 receptor agonists work really, really good. They're going to make you lose a lot of weight. You're going to become really slim, right? Semaglutide, tirzepatide. However, what they don't tell you when they prescribe you these two medicines is that once you stop taking them, your appetite will go back to what it was. So you're going to keep eating again like a pig and gain back all the weight that you lost during the many months and years when you were taking these expensive medications, GLP-1 agonists, semaglutide and tirzepatide. In addition to that, nobody knows what are the long-term side effects. What are the long-term side effects of these medications? We have heard of the risk of pancreatic cancers and other cancers. Who knows what else? What about dementia? We don't know. These are pretty new medications. So they have been approved very quickly because they are extremely effective, very efficient in cutting your appetite. You will no longer feel that food is the center of your universe. Dr. B, I have been able to do that naturally by myself, right? I have never been addicted to food. I mean, I used to a long time ago, but not that much. And now I am on a keto diet as of 10 years ago. I've been able naturally to train my brain to no longer need food, the same way I no longer need sex like I used to. I used to have sex every day at least, or at least every other day, and then on weekend it was constantly sex. Now I don't need it anymore. I don't see the point of having so much sex in my life. What is the point? What is the point of having constantly so much sex like I used to? What is the point? But thank God my testosterone is lower, so I have way lower need for sex than I used to, and I feel so much at peace in my brain and so much better, right? So who knows what are the long-term side effects of these kind of new medications? Have been around for a few years. And we know, again, I repeat, the risk of pancreatic cancer and other cancers. But who knows about other problems and especially the risk of dementia? Take a look at all these medications that we've been prescribing for many decades. Sleep medication, antipsychotic, anti-anxiety, right? Anti-acid medications, right? These proton pump inhibitors, right? All these medications for irritable bowel syndromes. A lot of people are now developing dementia because they've been prescribed and they've been taking these medications for years and years. So once you decide to take these medications, it is almost for life, because as soon as you're going to stop, you're going to go back to the same appetite and you're going to gain the weight. So you're going to be constantly under these medications. And I would like to quote one of the biggest physicians physicians, Dr. Osler, William Osler. He was originally a Canadian doctor. He came to America, right? And he practiced medicine. He practiced medicine in America for many years before he died. He is kind of like a founding father of modern medicine, right? William Osler. And he said very famously, and I paraphrase him, it's not the exact quote, that the number one priority of a good doctor is to do everything he can to keep his or her patient away from any medications as long as possible. The job, I repeat, the job of any good doctor is to keep his or her patients away from any medication as much as possible and for the longest time as possible. So try to delay the more you can giving any medication to your patient, because you never know the long-term side effects. And even as I said, the medication that we've been prescribing for decades, sleep medicine, anti-anxiety medication, anticholinergic medications for irritable bowel syndromes, medications that we use for depression, anxiolytics, blah, 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 we are now finding. And of course, the proton pump inhibitors that they use for people who have acid reflux disease, acidity in their stomach, right? We have found out that when you take them for many years, which people do because they get addicted to them and they can no longer be weaned from these freaking medication, they develop dementia, right? So this is the same for this. And I'm telling you this from a patient that I saw just yesterday. And she told me that she had this bariatric surgery. And I told her, why did you decide to have bariatric surgery instead of having one of these medications for weight loss? And this is the result. This video is the results of my interaction with her. And she is obviously the one who told me that she decided to go on this bariatric surgery, which is done via minimally invasive surgery. Means they put you under general anesthesia for 1 hour or 2 hours or 2.5 hours. They do tiny little holes, keyhole surgery. They don't open your tummy anymore, right? We don't do those surgeries anymore. I mean, we still do, but rarely. Most of the time, we do minimal invasive surgery. You have just a few little holes. We call them keyhole surgery, right? And then the next day, you're out of the hospital. That's it, and you're done for the rest of your life. Your appetite is cut for the rest of your life because they cut a huge part of your stomach. So your stomach is so tiny that as soon as you eat a little bit, like Dr. B, I've never had any surgeries or anything, but me, I can. My willpower, my brain is made like this. I've never had any problem dieting, but everybody's different, and I understand that. That's why a lot of people need this medication or this medication, because they need help. Obesity is a disaster. It kills you. Same thing for being overweight. Slowly but surely it kills you. You will not age gracefully. I've never seen a patient in their 80s or 90s at our beautiful clinic, and in my entire practice, who are obese or overweight. They die way before that, right? People who are obese or overweight, they don't reach their mid-80s and mid-90s. I want to reach 100, right? All the patients that I see in our beautiful cardiovascular clinic who are in their 80s and 90s, right? They're all lean. So that's why I did my research on the National Library of Medicine at PubMed, and a few studies that I showed, proved that in the long term, the surgery, bariatric surgery, is absolutely way superior than taking these medications, because with this you're done. And again, I said it's a minimally invasive surgery. It's a keyhole surgery. They don't open you up. The next day you're out of the hospital. That's it, and you're done for the rest of your life. For the rest of your life, you will no longer need to eat like a pig. You will eat like Dr. B, just a little bit, 1 or 2 times per day. That's it. I eat such a little bit of food that each time I go to poop, I poop 2 times per day, right? Morning before my shower and evening after I come from the gym and I take my shower, right? Each time I poop, it's a little bit like a goat because I don't eat much, right? And that's how I'm super healthy for my age. I'm 50 years young. I'm healthier than any 20-year-old, right? So pay attention and think about it. If you suffer from obesity, we don't do this surgery for people who are just overweight. You have to be obese. And you are deciding to take one of these medications. Know that they work really good, but then eventually, sooner or later, you're going to have to stop it, right? How long are you going to take this freaking medication not knowing what it's going to do to your freaking brain and to your risk of cancer? Because they're just new. We don't have enough years of putting them on the market to know what the catso they do to your brain, right? And never forget what Dr. William Osler said. William Osler, never forget, the duty of a good doctor is to keep his patient or her patient away from any medication the longer possible and the more possible. Obviously, sometimes you have no choice. The patient is having a heart attack or the patient is having a septicemia, right? You need to do something, give medication. But the less medication, the better, especially this freaking medication that you have to take long term and for which we have absolutely not enough time of knowledge to know what the catso they do. So obviously, I did the research for you, thanks to my patient who gave me her feedback about her bariatric surgery. Right? Very, very easy surgery. She's done for life. So think about it. Think about it. GLP1, semaglutide, tirzepatide, that you have to take all the time for life. Otherwise, once you cut it, once you stop taking them, your appetite will come back. And then you will eat again and put food at the center of your life. Just like all my family member and my ex-girlfriend, compared to this. I'll never forget, this is done with minimally invasive surgery and the next day you're out. Very low complication in the hands of a bariatric surgeon. Find a bariatric surgeon. If you don't have the money to do this in America here or in the Western world, just save the money, go to Thailand, Malaysia, Indonesia. 3 of the best countries in Southeast Asia for medicine and surgery and everything else. They have nothing to envy from American doctors and surgeons. They have bigger and more beautiful hospitals than here in America, right? Thailand, Malaysia, and Indonesia. And the cost of healthcare is 1/3 of what it is here. So if you don't have enough money to pay for your bariatric surgery, right? Unless, of course, some insurance might cover it. I don't know. Check with your insurance. Or you might have a huge deductible. I don't know. Just check it. But if they don't cover it, just go save some money and go on a trip to Southeast Asia and make sure you go over there during the low season. Low season means the rainy season. The rainy season over there when it's nice and hot here, right? June, July, August, September, October. Let's say September, right? September, maybe October, up to October. These 5 months are the rainy season over there. And therefore, it's low season. The airplane is cheap. Airplane ticket, the hotel is cheap, right? You're not going to have all these crazy tourists to jack up the prices of hotels and airfares and everything. So think about it. I love you guys. Select yourself a bariatric surgeon if you are obese. If you are not obese, right, and you are just overweight, obviously nobody's going to do any bariatric surgery for you. Then your only choice is to go on these medications. If you are overweight and you haven't been able To implement lifestyle changes means to zip your mouth with your willpower, diet, exercise, blah, blah, blah. Remember, I always post these beautiful diets: keto, carnivore, MASH, and Mediterranean. Dr. B has been on the keto diet for the last 10 years. It fits my schedule, it fits my taste bud, it fits my lifestyle. But choose whichever one you want. As you get older, these two make more sense. This one has too much carb. So it's good when you're young and you need a lot of carb. But as you get older, the more carb you eat, sugar, right, carb, the fatter you become. And I didn't choose the carnivore diet because I don't want no meat in my mouth. I love you guys. Dr. B loves you. Dr. B loves you regardless of your gender, ethnicity, color of your skin, religion, sexual orientation, whether you're atheist, Buddhist, Hinduist, Muslim, Jew, Christian, whether you're Democrat, Republican, anything in between, or man or woman, or you claim to be anything in between. I love you. Dr. B took the Hippocratic oath to love every human being the same. In addition, I promise that I will never ever put my interest above you. Your interest will be always above mine. Thank you for your viewership. Thank you for your comments. Thank you for your encouragement. Thank you for helping me growing this channel so that I can reach more people with my science and knowledge and help more humans. Put your comments, your question, criticism. I also answer everybody who criticizes me. I love you guys regardless. Kopkun Makmak, Kopkun Nakrap, Sawadee Krap, and I hope to talk to you in the next video. Bye-bye.